It's time for your nursing tip of the week, and in this week's tip, we are talking about stridor. Did you like my little example of stridor? Stridor is a scary thing for the patient as well as the hospital staff because it is considered a medical emergency. We're going to be talking about stridor in adult patients because I am an adult ICU nurse, not a peds nurse, so these are some common causes of stridor and also what we can do about it. Stridor is that high-pitched sound that somebody makes when their airway is narrowed, and it can be an inhalation stridor, an exhalation stridor, or it can be both. The most common time I see stridor in the ICU is typically after patients are extubated and they have some swelling in their airway that's causing it to be more narrow. The other time I will see it is when patients are going into anaphylactic shock. But it can also be caused by vocal cord paralysis, or if a patient has like a foreign object or piece of food lodged in their airway. You may also notice that the patient drools or they can't speak appropriately as well. But regardless, narrow airway, something in the airway, something's blocking, stridor needs to be addressed right away. The treatment for stridor depends on what the cause of the stridor is, but typically there will be some sort of steroid given to reduce swelling. The stridor is being caused by a blocked airway, then we may need to emergently perform a bronchoscopy on a patient. If this is a post-extubation stridor, then a lot of times we will give racemic epi. Your role as the nurse is going to be to call for help, notify the provider right away, get your respiratory therapist in there, and manage the airway as best as you can until a provider arrives and gives you orders for the next steps. And that's all about stridor. Let me know if you have any questions.